Can addressing mental health make the pain less impactful? Mental health and musculoskeletal pain are very closely connected. It is common for people with pain to experience that pain affects their mood and well-being. Chronic musculoskeletal pain can affect mental health, and pre-existing mental health conditions can worsen pain. Therefore, addressing not only pain but also mental health can be important for many people with pain. How are mental health and pain connected? 1. Pain leading to mental health issues. Persistent pain can be a major stressor and lead to high rates of comorbidity. Studies show that between 30 and 45% of chronic musculoskeletal pain patients experience depression, and approximately 40% report clinically significant anxiety. 2. Mental health conditions can make perception of pain more intense through shared neurobiological pathways. Dysregulation of key neurotransmitters like serotonin, norepinephrine, and dopamine, which are crucial for both mood regulation and pain modulation, contributes to this heightened sensitivity. Emerging evidence also points to systemic inflammation as a common underlying factor. 3. Psychological factors significantly impact pain. Depression can lower an individual's pain threshold and tolerance, making stimuli feel more intense. Anxiety often leads to pain catastrophizing, a tendency to dwell on pain, magnify the perception of its threat, and feeling of helplessness, thereby increasing perceived pain severity. For these reasons, psychological approaches like cognitive behavioral therapy and acceptance and commitment therapy have been found useful in reducing the negative impact of pain and suffering. 4. Common comorbid patient profile. Patients with co-occurring chronic pain and mental health issues often present more severe symptoms for both conditions, significant functional impairment, and a reduced overall quality of life. This profile is particularly prevalent in conditions like chronic back pain, migraines, and fibromyalgia, where approximately 54% experience depression and 56% anxiety. Therefore, collaborative approaches combining pain rehabilitation and mental health support yield better long-term results. How to introduce the relationship between pain and mental health to patients. 1. Normalize mental health treatment. Help patients understand that seeking psychological care is not about it's all in your head, but about improving coping and resilience. 2. Identify when mental health issues are comorbid versus secondary to pain. Screen for pre-existing conditions that may need specialized intervention. 3. Refer to mental health professionals or general practitioners when needed. Collaborate with psychologists and psychiatrists as part of a multidisciplinary approach. 4. Emphasize self-management strategies. Encourage relaxation techniques, mindfulness, and emotional regulation skills alongside physical rehabilitation. And 5. Reinforce that pain treatment and mental health care are not mutually exclusive. Both should be addressed simultaneously for better outcomes. Let's put it in practice. Daniel is a 42-year-old patient with chronic low back pain, long history of anxiety, and recurrent depressive episodes that predate his pain. His mental health symptoms complicate his ability to engage in rehabilitation and daily activities.
Daniel, I know you've been dealing with pain for a long time. How have your mood and stress levels been during all this?
Honestly, I've struggled with anxiety and depression for years, even before my back pain started. But now, everything feels worse.
That makes sense. Chronic pain and mental health conditions can reinforce each other, making both harder to manage. Have you ever considered mental health support as part of your pain treatment?
I don't know. I feel like I need to fix my back first before worrying about my mental health.
I hear you, but pain rehabilitation and mental health care don't have to be separated. In fact, research shows that addressing both at the same time may lead to better results. Psychological support can help you cope better with pain and improve your ability to engage in your pain management program.
So you're saying my pain isn't just in my head?
Not at all. Your pain is real, and we will address it. But as anxiety and depression were already present before your pain, managing them will help you get the best possible outcome from your rehab.
I never thought about it that way. Maybe I should give it a try.
To sum up, mental health care is a crucial component of pain management, particularly in patients with pre-existing psychological conditions. Encouraging a combined approach to physical and mental health treatment leads to better pain outcomes, improved functionality, and overall well-being.